I'm Dave Cuneo. I am the owner of Health Plan Advocate. Started Health Plan Advocate back in 2001 with a couple of investors. When we started Health Plan Advocate, what I was looking for was to provide a new way of providing health management and wellness services. I've been in the field since 1983, actually towards the inception of the concept of health management. I started with an organization that we primarily provided utilization management, hospital pre-certification services. And I often tell people, the professionals in the health management business really kind of started on the wrong end of the spectrum. What we did is we started with the concept or the premise that we needed to manage healthcare providers. And it was true in the early days when we provided, for example, hospital pre-certification services. What we were gearing ourselves towards was trying to eliminate waste that was in the system. There was plenty of waste back then. So we started on that end of the spectrum, working with providers, the premises that the providers were the problem. And yeah, they needed to be managed. Someone needed to be looking at that because you had a break between who was paying for services and the person that was receiving it. So it wasn't the normal consumer type concern about the services that I received. And so if I was going to get a lobster dinner for staying the third night after the birth of my son, why not? As long as my wife wanted to stay in the hospital and wasn't in a rush to get home. And providers took advantage of that. We have wrung a lot of the waste out of the system, but there's still plenty of waste that exists today. Really, when I started Health Plan Advocate, what I wanted to do was to get into health management and wellness that would focus on the individual, because that's really where everything was started. If we could put in place programs that would help people manage their lifestyles better by exercising more, by watching what they're eating, by taking care of themselves, that's really the way to attack the high cost of healthcare.